Thank you all for joining us today. All right. Welcome. So I'm Secretary Gillespie. Cindy, as most of you know me, the one you get an email from at least once a week, and it's great to be here with you today. So I wanted to, first of all, thank Dr. Joel Tumlison, who is on with us today from the Department of Health. Dr. Tumlison joined us, now it's been about two and a half months ago, when we first started into this public health emergency to try and help us understand a little bit more about COVID-19. And it was really, really helpful. So he has very graciously agreed to come back and talk with us some more today and answer some questions that all of you have sent in. I'm also joined by Kisa Smith, who is Deputy Director here. Kisa, along with the rest of the executive team, has been heavily involved in working on preparations to make sure throughout this public health emergency that we're operating as safely as we can, and also preparations as we keep moving along through this journey. I'm going to say one thing as we start, and then we'll get into the questions, but I think a lot of you got an email from me a couple of days ago, and I just want to repeat what I said then. Wherever we are in the last 3 months that we have been in this public health emergency, and wherever we are as we go through the next, as we are as an organization, as we go through the next months of this, it is not something that we can do alone to keep all of our employees safe. It's up to each one of us. Safety in the workplace is up to every single one of us. And you have to remember that every day. How safe we are is up to you, each one of you. You have to practice good hygiene. You have to wear your mask. It's just not safe to all be congregated together, and it won't be for a long time to come. So please, we put out these rules for a reason. It's to try to help you know what to do. And I just want to emphasize as we start today how important it is that all of us work together to keep all of us safe and to keep our clients safe. We'll get started now, and I'll introduce Dr. Tumlison, as I said, over there at the Department of Health. They have had an incredible 3 months there, and even as we start, I do want to thank him personally, and also thank Dr. Smith, Dr. Patel, and all of the others over there who have literally every day been on the phone with us, have been guiding and helping us at DHS. I have never worked with another group of people that have been so responsive and so willing to work with us continuously with every question we ask, and helping us ensure that what we do is in the best interest of our employees, our clients, and the people of the state. So I don't know when they sleep because we call them all the time, but I do want to say thank you to Dr. Tumlison because he has been so wonderful. As we start talking through this, Dr. Tumlison, it would be really helpful. You know, when we talked 2.5 months ago, the virus was something that we were all newly starting to learn about. I know that the experts knew a good bit, but also in the months since then, there's been a lot of knowledge gained about the virus and how it works and how it spreads. So if you don't mind, I'd love to start by having you kind of bring us a little bit up to date about what is known about the virus now and how it spreads, and who is most at risk now that we've been living with this for several months. think you are muted, so let us make sure you're not, because we are not hearing anything here.
No, that's my fault. Sorry, I'm
There you
still
go.
a Zoom rookie, I guess. You thought I'd be used to that by now. Hey, sorry. I'm sorry. I'll start over then. I'll address some of those specific issues you mentioned. We have, and then I'll just kind of try and give a synopsis of things we didn't know the last time I talked with y'all, and that maybe we've got a little better idea about now. As far as how it spreads, that hasn't changed fundamentally. It's still primarily spread through respiratory droplets. Those droplets can land on surfaces. That's what we like to call fomites. If everybody's hearing all these words that we didn't bother using much yet before. But primarily it's spread through what we breathe out, respiratory droplets, and someone else breathing those things in. That's where the masks come in. So I just wanted to put another plug in for wearing face coverings. Cloth face coverings are showing more and more evidence of working to decrease transmission to those around us. But the respiratory droplets, they're trying to do more research to understand, okay, does this stuff get aerosolized when we breathe out? There's some indication that yes, now it gets to a lesser degree aerosol. That means it can spread a little further than because those droplets are a little smaller and they float farther. Thus, the need for the face mask. But most of it is by the respiratory droplet spread, and then you can touch a dirty surface and then get that in your nose and mouth if you happen to reach up and touch your nose or mouth. So those are still the things we're worried about. That hasn't changed fundamentally. When I said we're getting more research to learn that mask work, the WHO for the longest time was not advising masking for the general public, and then lo and behold, here in the last couple of weeks, I think they finally came around and reversed their decision regarding the WHO. Said, remember, this is the World Health Organization, and they have everywhere in the world and their ability to implement things in mind when they make recommendations. It doesn't always apply to certain more resource-rich nations, such as ourselves. So, but what I would say is one thing that I think really stood out that shows that these masks work, and it's something we've learned, is there was a case in a nearby state where two workers, you may have heard about this in the press, two workers salon workers went to work sick. There's debate about whether they knew they were positive or not, but they went. However, this salon was very diligent about requiring masks and they were cloth face coverings, is my understanding, for both the workers and the people who came in to be attended to. And out of 146 people that were exposed to these two workers during their infectious period, they have not yet documented a single case from them. They were able to get almost 50 people to come in and be tested after they said, hey, we found out you were exposed. They went and got tested. Nobody turned out positive. It's not a huge study, a huge sample, but there are more and more stories like that indicating that these things actually, if we use them, they will help protect us from transmitting to other people, and they'll even protect us from getting it to some extent. One other new thing that we weren't sure about, if you remember when I last talked to you, is we didn't know if you could spread it when you didn't have any symptoms. We didn't know if that was possible. We now know that's possible, and in fact, it's quite common. That's become clear everywhere, including here in the state of Arkansas. I'm seeing, many cases where there's people that, spread it and they just didn't know they were positive. And they, fortunately, it spreads easily within households. That's another thing we're seeing lately. Why? It's really hard to isolate yourself from your household when you live with them, especially if you're asymptomatic and don't even know about it. And so those are some things that we're seeing. There is coming out, I don't think it's very clear yet, but of interest to DHS workers. I think as, initially most of our diagnosed cases were not in children. And I think that was more of a sampling bias. Now we're getting more children coming back with positive tests. And as we thought at the beginning, it still seems the case, children are not suffering as much from this disease, thankfully. And that doesn't mean they can't. You know, we've all heard about this new thing, MISC, multi-inflammatory system of children. And that is a very rare complication of the immune response to this virus. But thankfully, it's really rare. We have not even had a case of that in Arkansas. So those are that's kind of a sampling, Secretary Gillespie, of some new things we found with the virus. Was there anything specifically you'd like me to address that I didn't?
No, I think that's great. A couple of questions that we got that were particular in that is, what is the mortality rate of COVID-19 now?
Yeah, it's still unclear, and it's kind of wacky. If you look around the nation, you know, depending on which state or city you look at the sample size of, or you look at the rates from, the mortality rate looks different. You know, initially it was always going to be 1% or less, and then things started happening in Italy and in Europe, and all of a sudden we thought the mortality rate was going to be 10%, and it looks like it's settling in around probably, as we know it now, 2% or less. As we get a better handle on how many people are actually out there that are infected, then that number is going to change. Probably overall, it's going to end up being less because the denominator increases, right? If your denominator of how many people are infected and your numerator is how many people die from it, that if you get more people in the denominator, that ratio goes down. But we just don't know the final answer for that yet. And, you know, scientifically, those are usually answers you get the full answer on, you know, a year or two into a new disease, really, unfortunately. But I think it's going to end up being about that range. The difficulty is that the rates of death are not equal across the age span.
I think we just lost.
Like that. So the mortality rate among the elderly, as we all know, is much higher than that 1 or 2%. And certainly the risk of death goes up if you have certain other health problems like heart disease, significant lung disease, kidney disease. I know many of you know these things well from the people we work with.
Another question we had was, are people who are at risk, those who are older, those who do have an underlying condition, like those that the CDC outlined, are they more likely to catch the virus?
No, it doesn't. It does not look like people that in those at-risk categories I mentioned are more likely to catch the virus than, you know, somebody who's in their household that doesn't have those risk factors. It just is that they'll be at higher risk for severe disease if they catch a disease. Now, they're not less likely to get infected either. I would say right now it looks like everybody's at equal risk for getting infected given the situation. If a whole of us were in close contact with somebody with symptomatic COVID, we would probably all have about the same risk of getting infected if we were all the same distance for the same amount of time, if that makes sense. So not at higher, the risk factors don't make you necessarily at higher risk for catching it or getting infected with it. They do give you a higher risk of being severely ill with it.
That makes sense. You know, you mentioned as you were talking about asymptomatic, you know, someone who isn't showing symptoms, and the importance of recognizing that the virus can spread that way. And so the importance of making sure when you are, for example, at work, you're wearing your mask, because the fact that you don't have a temperature doesn't mean that you may not have the disease. Here's, I think, a point I'd like to mention is, you know, one of the things we work with the Department of Health on is always what type of screening questions do we need to ask when people come into a building. Obviously, we take everyone's temperature to make sure there is, you know, they don't have a temperature, but we ask these screening questions. And I guess I just want to take the moment to really emphasize to all of you There's a screening question that we ask, which is, have you been exposed, have you been around anyone who might be, who is COVID-19 positive? That's an important screening question. The fact that you may have someone in your household who is COVID-19 positive, even if you're not showing symptoms, we ask you that so you won't come to work potentially asymptomatic. You need to go get tested, right? So be truthful with these questions. The questions are modified. Department of Health is periodically telling us, change your questions. And this is why. We have learned this. Ask this. And those are all things to try to help identify whether or not you should go be tested rather than coming into the office. So I just wanted to kind of follow up on what he said to explain. That's why we're asking those questions and the importance of being truthful when you answer those.
Yeah, I agree, Secretary, that having been, do you know if you've been exposed to someone with COVID-19? A very important question. Unfortunately, not everybody always knows, but if you do know, it's a very important question.
Right.
If I might go into just symptoms too, because there have been a lot of questions about what symptoms. We knew from the very beginning, and they remain the most common symptoms. That the most common symptoms are fever, cough, any difficulty breathing. Those are kind of the hallmark or most common symptoms. But as we've learned more, a large number of people, less than 50%, but still a significant number of people report sore throat as a symptom. This one thing we didn't know about before was this whole recent loss of taste or smell. I mean, that was a surprise. So that is something that can be a typical symptom. And even fewer numbers of people get some kind of gastrointestinal symptom like nausea or diarrhea or such symptoms. Those are, you can see that's like 7 symptoms. Some people just get very achy. That's a very common symptom. Myalgia, I'm coming down with something kind of feeling. So it makes it difficult to distinguish from other illnesses. But right now, we need to pay attention to those screening questions and those symptoms that they're trying to ask us about.
That's true. That's really helpful. It's I think, and Kisa, you may want to weigh in on this. One of the things that we also, as part of this, talk about is it is incredibly important that if you are sick, you don't come to work. It's not just if you are sick with the following 5 symptoms, don't come to work. His point is there are a lot of symptoms, and so if you are sick, don't come to work. That's the point. Don't show up. If you are at work and you get sick, go home.
Yes, I think the point that Dr. Tumlison and Secretary Gillespie are pushing through is that these are really volatile times, and we would rather err on the side of being precautious than having individuals come to the office and say, well, I'm not running a fever, but I really have not felt well for weeks at a time, because what we are seeing is that there is a significant amount of community spread. I know individuals are concerned about the numbers going up, and if you are not feeling well, please stay at home. We are going to, in the next week or so, put out information for our supervisors so our supervisors know what leave is available for staff, so that it is clear that staff have the ability to stay home when they are sick.
And Kisa mentioned fluid. We are living in a fluid time. It is, it's going to remain fluid. One of the questions that we are asked often is, when will things get back to normal? While most of DHS has continued coming into the offices, into the HDCs, all of our offices have remained open to the public. Our nursing home, our state hospital, our human development centers, while most of our employees have continued their normal work pattern of coming to a location, some portion of our workforce has been remote. And as we've moved to bring back some of the remote workers into the office spaces, we've been asked by several people, why are remote workers coming back in at this time? And I want to address that for a moment. The state itself is moving towards the next phase of learning to continue with this virus as a part of our reality. I think it's really important that we all understand, you know, when this happened 3 months ago, I know at least I thought, okay, we're probably going to be doing this for a month or two. We're probably going to spend the next couple of months, the next 3 months, maybe by summer this will be over. It's become clear that this is going to be our normal for quite some time. We got questions about when will a vaccine be available, and we'll talk about that in a minute. But until, it's not just a vaccine being available, it's people being vaccinated, right? At such numbers that it's no longer something that you have to worry about the spread. So we are going to be an organization that is going to have to do its business, take care of the citizens of Arkansas with this virus as part of our reality. And as the state begins to make its move, our businesses, our schools, our communities, our healthcare operations that are reopening, all parts of this state, as we begin to move into, all right, how are we going to continue in this new reality? We have to move with them. Think about the things that we do. You know, Arkansas has been very successful compared to many other states in terms of our elderly residents in our nursing homes. Having, you know, while there have been cases, we have not had the numbers and the percentages that many other states have. So our state is about to move to very carefully moving so that people can see their loved ones in the nursing homes. We will soon be moving to where people can see their loved ones in a human development center in certain conditions. This is all going to be done very, very carefully, right? What is one of our roles? I mean, one of our roles is that we regulate nursing homes. We're responsible for ensuring that they're doing what they need to do for infection control. We're responsible to ensure they're doing what they need to do to keep their residents safe. We all have to be able to do that job. We regulate child care centers. Child care centers are reopening. As they reopen, we're working in partnership with them, and we also have to be there to make sure that those children are safe. You know, role after role in our county offices, as the public begins to need more and more assistance, we have to be there. Our roles didn't stop during the pandemic, the first phase of this pandemic, but as the state opens more up and people go back to normal business in a very different way, we have to go with them. And that's what we're doing right now. And our challenge as an organization is, how do we do this and do it safely? And I would love to tell you more than anything that we will have 2 or 3 more weeks or a month of this, and then it'll be gone, but nobody's saying that. And I would love to tell you that we will not have repeats of there will be a COVID positive somewhere and we will have to stop and clean and send people home and have people tested. I'd love to tell you that things will settle down and life will go back to normal very quickly. It's not going to happen. I'm having to accept it. We're all going to have to accept it. And when we accept it, then we will do what we need to do to be able to safely continue our work and our jobs. So I wanted to just start with that. And as a piece of that, then if you don't mind, Dr. Tumlison, could we talk a little bit about the questions that we have been asked about a vaccine? Because we would all love for there to quickly be a vaccine and the ability for us to move back to a normal way of living and working.
Sure. Yeah, about vaccines, there certainly are dozens of vaccines that are in various stages of development. But what I would say is that they're in early stages of development, most of them. There's only one or two that are even getting ready to do effectiveness trials in humans. So most of them are in very early stages. Some, a couple or a few, are getting ready to do effectiveness studies. But those aren't easy studies to do. They're going to take time. I think the context for these vaccines is even if it took, like you hear some really, we're going to have one by winter, we're going to have a vaccine by winter. Even if it took until not this winter, but winter 2021, that would be the fastest vaccine development, if it was effective, in history. These things generally take years and years and years and years and years. Through technology and different better processes and the government's understanding ways they can remove barriers to getting those developed quickly, some of those things have compressed, and that is good news. But I mean, I think I'd be super surprised if there was a vaccine ready to give to humans that was effective before a year from now. I might be wrong, it might be sooner than that, but Secretary Gillespie also made a good point. It's one thing to have a vaccine ready, it's another thing to have it ready in numbers and actually administer it to all the people that need it. I mean, we're talking about worldwide here. There's nowhere in the world that hasn't been affected by this. And so, you start getting, where do we start? What countries? What portion of the population? Do we vaccinate children first because we think they spread it? Do we vaccinate elderly first because they're more at risk? I mean, these are difficult questions. And then the numbers. There's 300 and 30 million people in the United States. That is a lot of doses of vaccine to produce and get out there. Now, and then think of a worldwide population of 8 billion. It's going to take a while. So that's just a little kind of perspective on the vaccine hunt and chase. And that is if we can form lasting immunity from a vaccine to this disease, which isn't certain at this point. We're hopeful, and I hope that's the case, but it's possible that it could not be. So your point about we are going to have to learn a new way of operating is good, because if that doesn't occur and we've got to rely on natural or herd immunity that might develop to this virus, that's going to take even longer.
Okay. All right. Thank you very much. And so as we think about how we work and in this next period of time, one of the questions we've been asked by a number of people is how do you stay safe in what we call here cubicle land? Many of our workers, our employees are in cubicles, and so they want to make sure that if they are working in their cubicle, how are they staying safe? How are they staying safe here in the office?
Yeah, well, I think you have to apply the same principles that we're preaching and everybody's preaching over and over and over again, and that's space. So how much space do you have? We need to be 6 feet apart, if at all possible. And if we're in shared spaces, we need to wear face coverings as much as possible. We need to have meticulous hand hygiene. So, finding some way that you can clean your hands frequently with some hand sanitizer, you washing your hands even more than you would normally when we're working in shared spaces. Those two things are really the key. Can space out as much as we can and wear your face covering as much as possible. For instance, you're like, Doc, you're not wearing your face covering. Well, I'm in my own office with the door closed, and that is fine when you're not in a shared space. But when somebody comes to that door, I put my mask on before I start talking with them. When I go out in our little hallway with all the other offices here in the outbreak response section, I put my mask on. When I go out into the hallway to get a drink or go somewhere else, I put my mask on. So anytime you're in a shared space with other people where you aren't, you don't have a reasonable expectation of not running into somebody, then I'd recommend you wear your face covering.
I think one of the things that we're also doing is trying to make sure that people recognizing what you said about it's spread by droplets, right, and distance, making sure that people are not facing each other on the other side of a cubicle wall. I mean, that way they're all facing in a different direction. They're all facing in the same direction, and you don't have two people who are maybe 6 foot separate, but they are actually facing each other. So
Yes, I think that's a good move as well. These things are what when I've been doing the interviews or talking to people in the public about why do I have to wear a mask? I'm socially distancing. All these things. I like to emphasize that these things are additive. If we do one, there's some protection. If we do two, there's even more protection. If we add another one, we could orient our desk to not to all be facing the same direction, so none of us are facing each other. That's a little bit more protection. And the more of these things we add on to each other, the more protected we'll be. So taking multiple measures and not just hanging your hat on one is very important.
And I think it's important here, we've been talking about this a lot, look, we all need to be wearing our masks when we're moving around in, as he said, any area where we could run into somebody else. If you're in the hallway, if you're in a common area, if you're walking by others' desks or cubicles, you need to be wearing your mask. When you're talking with other people like that, you need to be wearing your mask. We need to do that to keep from spreading something to each other. And that's really, really important. So don't be, someone told me yesterday that they said, I felt kind of bad, but I passed so-and-so in the hall, and I said, you're not wearing your mask, wear your mask. I said, great. I mean, we need to ask each other, wear your mask, please. Don't be here without your mask in the same area as me. It's perfectly fine. If you and Kisa would together kind of address this next set of questions. People asked about testing, positive tests, process, about what happens when someone gets sick and what goes on. I mean, Kisa, if you wouldn't mind talking about what happens from a process part here when we get notification and how all of that works. And then Dr. Tumlison, if you could talk about, well, then what goes on from the point that health is notified and what happens then with the person.
Sure. So for our very first step, when someone tests positive, the first step is that person actually tells us that they're testing positive. So I want to make sure that everyone knows we're not getting any special notification. If you test positive, you need to tell your supervisor. And so when your supervisor gets that information, we do have a chain where that supervisor immediately pushes that information up to your division director or your office chief. From there, that information comes to the secretary's office because we have to move very quickly to notify the Department of Health that we have a staff member that has tested positive, but also to do contact tracing very quickly, which means we will be reaching out. We have designated staff members who will be reaching out to the individual who has tested positive to find out who that individual has been around, and so that we can notify those individuals to have them go get tested. And I want to pause real quick because I know we've heard complaints and about this, which is we've notified individuals in offices, both central office and county offices, that there's been a positive case, and we're having to close because we can do cleaning. And we immediately get a question of, well, who was it? And how do I know if that person was around me or not? And trust that we are doing the contact tracing to make sure we know who has been exposed, as Dr. Tumlison described, and what that exposure means. We cannot tell you, due to HIPAA regulations, the exact person that tested positive. Now, small offices or small worlds, we know you'll probably find out, but we cannot tell you directly that Jane Doe is the person that tested positively, and I know that's concerning, but what we are making sure of is that the individuals that have been exposed are notified, that they are told to go test, that anyone that is in an area that has to be clean is sent home, and equally that we make sure that those individuals that have gone to test, even if they test negatively, stay home for 14 days to make sure, again, that everyone is being safe, but equally that they have not been exposed to the extent that they have tested positively.
Dr. Tumlison, please go right ahead.
I'll just jump on that last part because it's understandably not real clear why. Why if I was exposed to someone and I went to get tested and I tested negative, why do I have to quarantine 14 days? That's a long time. You're right. The 14 days, why 14 days? Because we think that is the outer limit of the incubation period of this virus. What's the incubation period? The time it takes for you to get exposed and get infected with that virus to come into you, and the time that it causes you to start having symptoms or be sick. Most people are going to have that at about, the average is about 5 days, but some people it's out that far. So we want to be cautious and not miss people and re-expose everybody else again. That's why 14 days. Why, if you have a negative result, can't you go? Well, you can see as I described that incubation period, that if say you were exposed 2 days ago and you found out about it yesterday, and so you stayed home from work and today you went and got tested. Well, that's only 2 days in. It takes time for the virus to reproduce enough in your nose and throat, etc., lungs, to actually trigger a positive test. It might be that you just have so low levels right now that it's not going to make the test positive. But if you we've had cases where people got tested the first day or two after exposure, it was negative, they stayed on quarantine, and lo and behold, day 9 or 10 of their quarantine, they started having symptoms, they went and got tested, and now their test was positive. So that's why the 14 days. We want to get far enough out to make sure we're not missing people who we just caught early with the test, too early to trigger a positive test, if that makes sense. Then we talk a little bit about close contact, because who is exposed to a significant...
Uh-oh.
Are we all frozen?
Are we all frozen?
Okay, can you hear me?
Yes, there you are. Sorry about all that. Is he there?
Secretary Gillespie, can y'all hear me?
Yes, we can. You were just starting to explain.
I can't hear you, though.
You can't hear us? Okay, can you hear us now?
Okay,
sorry.
Can y'all hear me all right?
We can. You were just starting to explain to us what close contact is that means you've been exposed.
Okay, so close contact has to do with how close you were, but also how much time. So those are the two factors. The close we usually use as our benchmark is 6 feet, and the time is for 15 minutes or more. That's cumulative, like through the day. And so, sometimes that's hard to tell. For instance, if you came up and gave somebody a big hug and it turns out they were positive, if you called me here at the health department and they said, yeah, well, I hugged that positive person, I would probably say, yeah, you need to go get tested and quarantined. So physical contact, really close contact, kind of make exceptions, but in general, it's amount of time and distance. And so those are the kind of things we try to use to decide who's a close contact, meaning, and the people that are close contacts are the ones that need to get quarantined for 14 days and get tested. So I think, does that make that a little more clear, do you think, Kiza and Secretary Gillespie?
I think it does. It's one of the questions when we start the calls to try to find out around contact tracing. With somebody's positive, trying to understand what went on. Part of the questions are actually that, not just who's had close contact, 6 feet, 15, less than 6 feet, more than 15 minutes, but also one of the core questions we always ask is, So how well is that office or unit practicing good behaviors? How well are they wearing their masks? What's going on over there? And, unfortunately, that's why I think we continue to emphasize this, is that sometimes the answer we get back is, well, it's probably been a little scattershot. Hasn't been that everybody's been doing exactly what they should be doing. And that means that we end up having to take a larger group of folks and consider them to potentially have been exposed than we might have in an area where everybody's able to say, no, everybody's been really, really good. And everyone's been making sure that no one is looking at a computer screen over the shoulders of others and things like that. So just to really emphasize that point, that it matters in determining potential exposure. It's great.
Yeah, I agree, especially the issue of wearing the face covering really comes into play there. If we've got a kind of borderline one, we're not sure, maybe that was close contact, maybe it wasn't, should we quarantine this person? Well, were they and the other people wearing masks? If they're both wearing masks, we might go, okay, you're probably fine. If they weren't, we go, you know what, you probably need to be quarantined and get tested. So we do consider that in, a lot of those kind of ones which aren't real clear cut.
Yep, no, that's really great. So, I think we get asked sometimes, and you and Keisa could both comment on this, when we have a situation, what makes us decide whether or not an area should be cleaned, the entire office should be shut down? I mean, or is it okay just to clean a small area, shut down a small area? What goes into that decision making?
Well, I would just generally say certainly the areas where the person was, especially the areas they spent most of the day in, those areas clearly need to be cleaned. You would probably want to, which bathroom do they use? Do an extra special job cleaning that bathroom and the common areas that they might have used. But for instance, if I can't remember how many floors that DHS has, but if you had somebody that worked on the first floor and they never really went to the second floor, and there wouldn't necessarily be a need to shut down the whole second floor simply because the person that was positive worked on the first floor. You would need to have enhanced cleaning, better cleaning maybe than maybe you were focusing on in the past, just for the whole facility in general, just because that's the environment we're in now. But it wouldn't necessarily have to be a special focus. It's sometimes people have questions about what about spread through air conditioning systems, etc. I've not heard any reports of cases that you could say were certainly spread through air conditioning systems, like somebody on the second floor that never had any contact with somebody on the first floor getting it, and there was no other way to explain it other than that. It's not been documented as spread through an air conditioning system or things like that. It does not spread by just filling up and floating through the whole facility. It is really about close contact, and especially close contact over a long period of time.
Great.
And I would only add that when we make the determination about where we're cleaning, and to the extent that we're cleaning, we're doing that in consultation with the Department of Health. And so we are telling the Department of Health where that individual has been, which again goes back to, if you are not feeling well, stay home, because the longer an individual has been in the office not feeling well, potentially being infected, but going about the office, that means that the greater likelihood that offices are going to get shut down to be cleaned in terms of us having to clean the entire office.
So we had one employee who asked, what are the notification requirements? I assume meaning if they did find out that they have been, that they are COVID positive, if they took a test and they're COVID positive, what should they do?
If an individual, if you test positively, like we said, notify your supervisor immediately. And then we're going to give your supervisor the outline so that they'll know who to contact next. Again, they'll contact the division director and move that up the chain so that we make sure that we're acting quickly. But an individual that tests positively, their first and only requirement for us is to contact their supervisor or get someone to contact their supervisor as soon as possible.
You know, and I'm stating the obvious. If you have taken a COVID test, you should not be coming into the office until you know it is negative, right? If for some reason you have taken a test and it's not because of exposure, you should not come into the office. If it was because of exposure, you are going to be not coming in for 14 days. But because you're going to be quarantined. But if you have taken a COVID test and you are waiting your results, you should not be coming into the office. So when you find out you're positive, you should be at home calling your supervisor. We should not have a situation where somebody is at work and gets the results of their COVID test. Okay, that's just stating the obvious. If you thought there was a chance you had COVID-19 and you went to take a test, you should be staying home until you know you don't.
And supervisors, if a staff member tells you that they are not feeling well and they went to take a test and maybe they're saying, I'm not running a fever, or I don't have a cough or anything of that nature, but they have confirmed that they've taken a test, send that staff member home.
Dr. Tumlison, you mentioned the cleaning of bathrooms. So one of the questions we were asked is it safe to use a public toilet during this health emergency?
Yeah, I think it is. I mean, even in a bathroom, you remember the way we contract this disease is by breathing it in. Somebody breathes it out, and we breathe it in. So really, in my mind, we all worry about catching many things in the bathroom, right? With this one, it's not any more particular that the bathroom would be a bad place than anywhere that was crowded or anywhere that people touch things. So, it's really a matter of the sink faucet, et cetera, that, the paper towel dispenser. So we've all kind of been learning ways, the routine of going through that without touching things. You pull your paper towel out first so that once you get your hands clean, you can shut things off with a paper towel and not with your bare hands that are now clean. So, I think it is safe to use public restrooms. Public restrooms need to be cleaned frequently, and I'm sure that's going on. But, just employ some of those personal safe measures of ways of going to the bathroom. But yes, we've not discovered that transmission is any higher in a restroom than it is anywhere else where people go. So it's really about close contact with others.
Okay. So we have a couple of questions that have come in from our county offices. If you've got any helpful tips for them. At some point, we will resume interviewing clients in person. The federal government has temporarily let us not have to do that face-to-face, and they're going to be eventually requiring us to resume that. Given that it may be that the people we're interviewing have not been practicing good social distancing and they have not been wearing masks when out in public before, are there any precautions that our employees could take in addition to obviously us wearing masks and asking them to wear a mask?
I think absolutely making them wear a mask is a great one. In my mind, that's the reason they would not do the interview if they refuse to wear the mask. And I think social distancing in this situation works. You just might have to adjust where you do that interview. It might not be where you normally did it because there's not enough space for you to sit, a good 8 or 9 feet apart from that person while you're interviewing them. But I think I would feel comfortable with just a normal interview. We're not going to shake hands, we're not going to hug or things like that we would normally maybe do, but we're all getting used to that part of it, even though we don't like it. At least I don't. But yeah, I think it's really about, can you social distance from that person and have them wear a mask? I would say with those couple of things in place, I would feel comfortable with interviews. For instance, psychologists had this question of us, and we talked through with them, and they're back seeing more people face to face if they can keep the social distancing and face coverings.
Okay, no, that's really helpful. Is it safe to keep a mask on for 8 hours?
I believe it is. I've heard lots of people have concerns about it. But I don't, I've not heard anything where any untoward health effects are going to occur by wearing, one of these. Might that be different if you're like a nurse wearing an N95? Well, a lot of them are using those N95 respirators for long periods of time without being able to take them off. It gives a terrible feeling, but it hasn't been proven harmful, much less, these that actually do breathe. Now, it feels very strange, especially if you're out somewhere warm, so you have to keep that in mind. But in a normal inside office setting, you should be fine wearing a face covering for extended periods of time.
Great. And I think maybe the last question, because I know we're coming up on 2 o'clock, we had two quick ones. One person did ask, is there a medication approved to help deal with COVID-19?
There is one medicine currently for severely ill people. That's the remdesivir you might have heard about, but that's only for hospitalized people. Remdesivir is an infusion. You get it through an IV. It's really only for people that are severely ill with it. Like basically, if you're not requiring oxygen, you don't get it. Now, there's not another pill form. There was a lot of debate about hydroxychloroquine or chloroquine early on. We thought it was getting promising. As more studies have done, it's been less promising. In fact, the FDA just pulled the authorization to use it for COVID for those who haven't already started on it. So that was a little disappointing, but that's where the science went. And there's been some recent studies in Europe, but again, they're for hospitalized patients, severely ill patients, with the use of a steroid called dexamethasone. Now, don't rush out and try to take steroids just because you've got COVID. Most of the people that haven't had to be hospitalized have done quite well without a specific therapy. And always, taking anything for something like this, you need to do a consultation with your doctor.
So I think the final question we have here is, will the numbers continue to rise? I assume that's both of positive cases and as well as hospitalizations.
Well, the cumulative numbers clearly are going to keep going up. Will the recent high numbers of new cases continue to rise? There are some signs this week that they're not gone down significantly, but they are kind of leveled out in the mid to high 300s, or low to mid to high in that range 300s, which is better than they were last week. I would say it remains to be seen. I think, yes, ultimately, in a couple of weeks, we'll probably go, okay, the numbers are coming down again. Maybe, but that's not certain, first of all. That depends a lot on people's actions and activity and how much individuals in the state of Arkansas are using these, avoiding big crowds. Are they socially distancing? So it's kind of all in our hands here in the great state of Arkansas and in the nation as a whole. However, the pattern, I think, is probably going to be, okay, well, it's going down now again, and then, depending on how things go, you get another bump in cases go up for a little while, and then, I hate to think about it, but I kind of anticipate we might be on this little bit of a roller coaster ride with these cases. Hopefully it won't be a terrible thing where the high spots keep going up. Hopefully it will be a case where when the bumps do go up, there are lower peaks instead of higher peaks. That's what we want to try to accomplish.
Right. And that kind of circles us back to where we started, which is we are going to all have to be fairly fluid over the months to come. I mean, we're going to have to be prepared if something happens to shift to remote work, shift back in, shift to remote work, shift back in. Y'all will continue to learn more about the virus as we go, and as you do, we will probably modify some of the things we do. We're just not going to be in a same routine for quite some time. So it's rough, but if we all know that it's going to be that way, then I think we can be better able to deal with it and better able to continue our lives as we move through this roller coaster, as you put it, over the months ahead. Thank you so much, Dr. Tumlison, for joining us. It is always so incredibly helpful to hear from you and to be able to ask you some of the questions that we're hearing. And I will say once again, I really, truly appreciate the help we've had from the Department of Health and all of the doctors and medical professionals there. Y'all have just been so wonderful to work with. So we ran a little over 5 minutes. Apologies to all, but thank you so much for joining us today. And wear your mask, stay 6 feet from folks, and wash your hands. Thanks.